Hello, my name is Savannah Carrico, and I'm the epidemiologist for the Durham County Department of Public Health. Thank you so much for joining us for this training for the Community Health Assessment Survey. For our agenda, we're going to go over the Community Health Assessment and its history and importance. We're going to go over safety measures, COVID-19 precautions, interview techniques, survey materials you'll bring with you into the field, cluster sampling and how it works and how to read maps, tablet introduction, and frequently asked questions. Lastly, we'll go over what to expect on the day of the survey that you're volunteering for. The Community Health Assessment is a partnership between the Durham County Department of Public Health, a Partnership for a Healthy Durham, and Duke Health. This survey allows us to create a comprehensive report for how Durham County residents feel about the health of their community. This helps us get buy-in from community organizations and elected officials to make a difference. The purpose of this assessment process is to continually assess the health of the community, identify key health priorities according to community members, develop action plans to address priority areas and ultimately improve the health of the community. We strive to make each assessment better than the next. Durham County has been performing this survey since 2010. It is a measurement of the health of the community and its residents. We want to know how Durham County can help, what are the things that can make Durham County great, and what about Durham County do you like and dislike? For the countywide survey, people must be at least 18 years or older and live in the home. For the Comunidad Latina survey, they must be 18 years or older, live in the home, and be of Latina descent. Hispanic and Latina residents may participate in the countywide survey. This is only a requirement for the Comunidad Latina survey. We would like to acknowledge that we have won awards of excellence for both our 2017 and 2020 community health assessments. There are lots of parts to complete this project. We have completed the final version of both the countywide and Comunidad Latina surveys. We have also selected the homes for which we will survey. If the person does not answer, we will move on to the next house. Currently, we are in the stage of collecting primary data. This is a very important step in this project so we can collect primary or first-hand experience responses from the people in our community. There are a couple safety issues we want you to consider. First and foremost, we want you to drive safely and obey traffic laws. Second, we would like you to wear volunteer t-shirts, which will be provided at the Durham Children's Initiative if you do not have one. Please wear your badge if you do have one. Lastly, please check your cell phone throughout the day as there may be updates to your route and for survey testing. There are lots of things to consider when you're approaching a home. If there are unleashed dogs or dogs in a fence, please consider your safety options. It is okay to leave if you feel unsafe or uncomfortable in the situation. If that is the case, please call me immediately. If you can, please complete the interview outside of the home. Never use the restroom at someone's house. Always wait to find a public restroom. Please do not accept food or drink, and please never split up. It's very important that you keep your equipment safe. You'll be allowed a tablet and a charger. That tablet is to be kept confidential. Please do not leave it in the car or on the dashboard. Please keep data secure by locking your tablet when not in use, and please maintain the confidentiality of responses. Do not collect the name or address of the person that you are surveying. COVID safety measures are important for this survey. Please wear a mask when you are approaching a door and maintain a 6-foot distance from you and the household member. If you come across someone that is offended by your wearing a mask, please explain that it is just a common procedure and you practice it because you are in contact with a lot of residents during this survey distribution. The most important thing to remember is that if you feel unsafe or uncomfortable approaching any house, please leave immediately and call me. Remember, for COVID-19, refrain from handshaking, make sure you have your personal hand sanitizer, and please keep a 6-foot distance at all times. It's important to remember to not engage in political discussions. It can be interpreted wrong. If a resident gets off topic, simply remind them that you are there to collect information from the survey and to remain on topic. It's important to remember that you can make or break the interview. We want you to be enthusiastic and passionate about the survey that you are giving. We want you to remain neutral. There are no right or wrong answers, and we want you to set the tone for the conversation. Be open, be friendly, and remain on topic. Remember to stay neutral. Don't let your facial expressions or body language give you away. Respond with okay, next question, or thank you, next question. If an answer makes you unsafe or uncomfortable, please leave and contact me immediately. When you're approaching the door to a home, remember to wear your mask. Remember to maintain a comfortable distance. Stay 6 feet apart from the door entry. Knock and step back. Please stay on the stoop and try 2 or 3 times to either knock or ring the doorbell. If there are gates, you can ask to enter. If there are screened-in porches, remember to ask to enter. When you're approaching a door and someone answers, maintain eye contact and smile. Ask them how they're doing. Try to refrain from handshaking due to COVID-19. Remember to introduce yourself. Try not to read from the script. Practice your pitch. Keep it brief and try to relate to the person. There are a few things to remember to include when you're giving your pitch. Remember to state your name and your organization. Ask them how they're doing. Make sure that you maintain a smile. Tell them that you are conducting a survey that will take between 20 to 25 minutes. Let them know that if they participate, they will receive a small thank you gift. Remember to state clearly that their answers are anonymous. Then, at the end, ask them if they're willing to participate. As a final reminder, stay neutral. Watch your body language and your emotional response. Be accepting and compassionate when appropriate. Say, I can understand that, or I'm sorry you experienced that, or thank you, next question, or okay, next question. There are a lot of things to remember when you're giving this survey. Remember to ask questions as they are written, ask the questions in order, ask every question specified. Please record responses accurately. This will help us maintain data integrity and it will help us interpret answers. Practice active listening, so read nonverbal cues, repeat the participant's response. Avoid asking leading questions. There are a couple of techniques to consider when you're conducting the interview. It's okay to pause and wait for a response. Repeat the question if necessary and clarify the question. The next slide will give you more information. We have 2 questions on our survey in the demographics section, one of which is asking how the person identifies their gender. The other asks the person how they identify their sexuality. These can be some interesting topics to approach with somebody that you're giving the survey to. It's important to remain neutral in your responses. If the participant is confused about the options, please explain them clearly. If the participant is offended by your asking these questions, please remind them that we are asking these questions of everybody, and it will help us standardize our data. There will be times when the participant is confused by a question. It is important to not repeat the question as is, as that has clearly confused them. There is another way to approach the question. Either reframe it in your own words or add clarification, such as, if someone is confused by how often they get social and emotional support, you can remember to also remind them that support can come from any source. This may clear up any confusion the participant may have. You will go out in teams of 2. The first surveyor will greet the participant with a practice pitch, introduce the purpose of the survey, and conduct the interview. Team member 2 will stand off to the side, record responses in the tablet. If there are technical issues, you will record them on a paper survey, and you're responsible for asking for clarification if needed. There will be several things to take with you when you go door to door. Remember to carry with you incentive bags. There will also be a GPS tracker sheet that needs to be filled out for every address you visit. There will also be a sheet with my contact information. You will have to check out a tablet and its corresponding charger. We will have both surveys in Spanish and English available should you need to use a paper survey. We will also provide you with a binder with a lot of information, including the media release, helpful reminders, and surveys. There will also be mileage reimbursement forms if you are a county employee. There are a few things to remember when you're leaving for the field after you've checked in at the Durham Children's Initiative. Most importantly are the binders that you will take with you. Please double check the front of the binder to make sure you're using the corresponding survey. If you have signed up for the countywide survey, please use that binder. If you signed up for the Comunidad Latina survey, please use that binder. Those title pages will also tell you the clusters that you are responsible for. Secondly, please make sure to gather at least 10 incentive bags with you. This will be important for you to give incentives to anybody that completes the survey throughout the day. There will be several tracking sheets per cluster map in your binder. These tracking sheets are important because they will allow us to record the status of the survey that we have tried to give. Please include the cluster number, which is located at the front of your binder. Please select yes or no if the survey is for a selected household. These selected household addresses will be located at the bottom of your map sheet. Write in the address, city, and zip code. Use your geolocator on your tablet to enter the longitude and latitude of the home. Then use either of the 6 codes provided at the top of the tracking sheet to record the status of the home. Located in your binder, there is a press release used to advertise the Community Health Assessment Survey and encourage participation for our community members. This can be helpful if somebody is looking for official documentation of the survey that we're giving. We are doing a 2-stage cluster sampling method. We are randomly selecting census blocks in Durham County. We are randomly selecting 7 households within each census block. We have randomly selected 75 census blocks for our county-wide survey and 35 census blocks for our Comunidad Latina survey. When you are out in the field, please remember to complete your tracking sheets. This graphic here describes 2 cluster sampling methods. On the left, you'll see that there are red circled houses that have been selected. Those represent a census block. To the right, you'll see within that census block, there are select houses that have been identified as randomly selected households for this survey. When you are driving in your census block, remember to park in a safe place. Begin at the furthest point from the base station and work your way back. Remember, do not split up. Make every effort to close out a neighborhood before moving on. We are doing something new this year. For every selected home that you go to, if there is no answer, we will be placing a door hanger that will give them information on how to complete the survey, either by phone or online. Please leave door hangers only at the randomly selected house. Do not leave a door hanger on all the houses that you knock on. Please include a unique ID on the door hanger that you will have to pen in. If you are giving the county-wide survey, the door hanger will begin with a unique ID that starts with C. If you are giving the Comunidad Latina survey, your door hanger will have a unique ID that begins with L. For example, if you are giving the community-wide survey that is at cluster 5 and house number 3, your unique ID will be C0503. If you're unsure of the unique ID, it is located at the end of the address of your maps. Located in your binder is a set of maps for each cluster that you are responsible for going to. The maps will have a big area followed by the addresses and unique IDs for each of the selected households. When reading a map, you can look for the blue line that encapsulates the entire cluster. There will be 7 dots within that cluster. Those are your selected households. When you arrive at your cluster, there are 7 homes that are selected for you to go to. The first home you should go to is the unique ID with either C or L the number of your cluster, which is located on the front of your binder, and the house selected. For example, if you are in cluster 17, you are at your first house. On the map, look for where C1701 is located. Again, that unique ID, the C1701, is located next to the address of the first house at the bottom of your maps page. If you are at a selected home, leave a door hanger. Then proceed to the next physically closest home. Keep on knocking on doors of the next physically closest home until you receive a survey. If you complete a survey at a home, move on to the next selected household. You will go out in teams of 2. The first surveyor will greet the participant with a practice pitch, introduce the purpose of the survey, and conduct the interview. Team member 2 will stand off to the side, record responses in the tablet. If there are technical issues, you will record them on a paper survey, and you're responsible for asking for clarification if needed. There are a few things to remember when entering data into the tablet. Red italic text should not be read aloud. This is instructions for you and your team member. For other boxes and for qualitative response boxes where there are no multiple choice questions, please write in the participant's response. If they do not wish to answer or do not know, please write that in the text in the box. Skip patterns are written in red text and will be automatically skipped throughout the survey. We are fortunate to have brand new tablets for this community assessment. There are a couple things to know about these tablets when you receive them. They are in an OtterBox that will protect them from dust and light. However, do not drop the tablet as we are not sure it will sustain the impact. If you do drop the tablet, just continue with paper surveys for the rest of your shift. If you want to view settings, you can swipe down twice. Please make sure to leave Wi-Fi off to preserve battery, and it should be gray when you swipe down in the settings. Please leave the location on. This will allow us to track you throughout the day, and it will let us know if you get lost or are in the wrong location. Please be mindful of the battery. Please check it around lunchtime, and if it's below 50%, please use the card charger provided to you. These tablets have 3 buttons located at the bottom. There is a 3-bar button that will open all apps, and it will let you see how many apps are open in your device. There is a square button that will take you to the home page. There is also a back arrow that will take you back to the original page that you were on. When you've turned on your tablet, by holding down the top right button, this is the lock screen that will come up. Please remember to use this pattern when unlocking the screen. When you arrive at your cluster, be sure to check the Field Map button located on the right of your tablet. This is used to make sure that you are in the right cluster. When you select Field Maps, an entire map of the county or your location will appear. Remember to click the button in the top right corner of the map, and that will localize you to your location. Once you have located yourself on the map, click the back arrow in the top left. This will take you to the home page where you can select which survey you are participating in. You may select the countywide survey or the Comunidad Latina survey. Once selected, this will allow you to see if you are in the correct cluster. These are the 2 options available to Durham County. There are other maps listed in the tablet, but please ignore them. When you are ready to begin the survey, press the offline survey button on the left-hand side of your tablet. When you open the offline survey app, there will be two options to select. The first option will be for the Comunidad Latina survey, and the second option will be for the full county-wide survey. Please select the appropriate survey that you have signed up for. When you open the survey, there will be a few question prompts. At the bottom of those questions, there will be a spot to enter the unique ID for the survey, which is located next to the address on your maps, and there will be a spot to enter the address. Please do not enter the address of the person you are surveying. This is for a different survey. When you select the survey that you are participating in, please select the Take Survey button in green. There are three major buttons to remember when operating the tablet. In the top left corner, there is a Restart button. If you press this, your survey data will be lost. If you would like to press this, it will begin a new survey. In the top right, there is a Close option. You will be prompted to save the survey, name it, and it will be saved until you return to it. In the bottom right, there is a Next button in blue with an arrow. This will let you proceed to the next set of questions. Remember, when you are completing a survey, do not select the Back button at the bottom of your screen. This will exit you out of the survey and it will not save your data. If you wish to go back to a question, click the blue arrow in the bottom left of the survey. There are several questions with skip logic built into them. One in particular that is new this year are the discrimination questions. If someone has felt that they have been discriminated against, there will be another question prompting them to specify the location in which they experienced this discrimination. Once a location is selected, a second set of questions will be prompted through the skip logic in the tablet. This is to select either interpersonal or structural discrimination. This is either up to you and the participant. For a few questions, there are not multiple choice answers to select from. In this case, there will be a text field box. Please write the person's response in that box. If they do not know or do not wish to answer, simply write that in the text field so the answer is saved. If the person does not have time to complete the survey or like you to come back later, there is an option to save partial surveys. You'll have to name the survey to go back to it, so we strongly suggest you use the unique identifier that is located next to the address in the Maps page in your binder. When you are finished taking the survey, there will be a green button that says Restart. This will allow you to open a new survey. It will not delete the data that you've already collected. We would prefer volunteers would be able to complete their entire shift. Shifts are Wednesday through Saturday from 10 a.m. to 6 p.m. If you are unable to complete your shift, or if your partner does not show, please contact me at 919-251-1578. We will try to partner you with a member of the population health team so that you may complete your shift. If you have knocked on every door in your cluster and you do not receive any answers, make a note in your tracking sheet and we will return a different day. It is uncommon, but in some cases within your cluster, a business is selected. In this case, do not go to that business or ask for surveys to be completed. However, If an apartment complex or condo complex is located above the business, please make every effort to reach those units. In some clusters, you may be assigned an apartment complex. This can be kind of tricky. To approach these types of situations, just pick a random building and a random floor and a random door. Most likely, you'll have more luck with apartment complexes than you will with normal homes.